Oh, okay. I think we'll start with introductions, and I have the icebreaker question to be, what was your favorite Halloween costume you've ever worn? I should have thought about my answer before I made this the question. Um, my name is Natalie Updike. I work at the Kansas City Healthy Lifestyles Collaborative. I support our early childhood sector, among a few others, on our Kansas City physical activity plan. Um, I I think maybe one of my favorite Halloween costumes is we went as Velociraptors when the first like reiteration of the Jurassic Park movies came out, and there was a huge group of us, so it was just a whole bunch of us dinosaurs roaming about. Kelly, would you like to go next?
Hey everyone, I'm Kelly Clay. I also work at Kansas City Healthy Lifestyles Collaborative with Natalie, and am starting to help support the childhood sector, along with others as well. Um, my my favorite Halloween costume, I made myself into an ice cream cone. Like I had like a headpiece thing that was the ice cream, and then my body was the cone. It was fun. So yeah. Lori.
I think my favorite costume.
You're muted.
That's funny because I could hear myself through Aaron's over there. So my favorite was probably second grade, Mrs. Bodendorf's class. I was a princess and I had a big hoop skirt. So I couldn't sit down once we got into costumes. So it was very, and it was just made from a dress that I had wore for my cousin's wedding. And so it had this big off the shouldery thing, and but it was just that big hoop skirt that made an impression. And should I call the next person? I'm going to call Miss Rhonda.
Good morning, everybody. I'm Rhonda Erpelding, and I'm with the Kansas Center for Autism Research and Training. And I'm going to go way back to memory, but I remember wearing a Wonder Woman costume back when I'm dating myself, back when you used to get like the outfit and then you got the plastic mask. Oh, okay. Way far ago. Far time ago, but that is one that I remember from childhood. I don't really remember doing much as an adult. Lisa.
Thanks, Rhonda. I love your sweater. I was just thinking that when I saw. So cute. Or your shirt, whatever. I am Lisa Lauer, and I'm with Missouri Department of Health and Senior Services. Um, I my I feel like when I was a kid, my costumes were kind of just not. I always liked. It was always fun to plan our costumes with like my best friend. One year we were little girls. We were older in grade school, so we thought we weren't, but that was a really fun costume. I really enjoyed making my children's costumes, I would say, more than, planning what they wanted to be. That's one of my best memories, I guess, was just figuring out what they wanted to be and then either sewing them or putting them together. That one time one was Dorothy, one was Willie the Wildcat with a huge paper mache head. And so that to me was really fun from Halloween memories. And I'm going to toss it to Katrina.
Good morning. I'm Katrina Minter with the Family Conservancy. Yeah, Halloween wasn't a huge deal. It was just dressing up in something you had around the house and hanging out with some friends from the neighborhood. So probably an Indian girl was one of my that I remember. So just using things we had at home, and yeah, we would dress up and walk the neighborhood. I will pass it to Chris.
Good morning. I'm Chris Nicholson. I'm with Child Care Aware Kansas. I feel like I've answered this question a lot recently, so I apologize if people have heard this repeat. My sister made my friend and I a push me pull me costume. So if you know, two llama heads, so we had to, you know, coordinate and cooperate. One had to walk backwards, one had to walk forward. So that was a lot of fun. Natalie, I'm not sure who all has not been.
Aaron, maybe.
Aaron, yeah, I just looked at my. All right, Aaron, it's up to you.
Oh, you're muted.
There you go. Okay. Erin with Child Care Licensing in Wyandotte County. My favorite costume as a child was Big Bird. My mom made a big yellow everything, tons of feathers and stuff, and that was just really fun to walk in. But as an adult, well, I was in college and a whole group of us from K-State met up with a whole group from KU, and we were all the Brady Bunch. That was fun. And that's it.
That's cute. That was a blended family. Okay.
Erin, were you the youngest one in curls?
I guess we'll just jump right into the agenda. I think we'll have a relatively short meeting, but we just kind of wanted to do a wrap up from the conference since we spent most of the year working on that. We got the evaluations from the Family Conservancy. We appreciate them entering the data and doing the evaluation on that. It looks like we had 62 attendees, but for some reason only 60 turned in evaluations. We had about 12 volunteers. Really appreciate everyone that was able to come that day and support. I think we ended up having plenty of help and had really good feedback on the evaluations. The average score for the conference was 4.92 out of 5. There was really only like 1 or 2 people that seemed to have any negative scoring. There was a optional question and it looked like only 1 person filled that out. And it was related to what type of training request you have for the future. And they listed infant development with older kid and toddler participation integrated for that. Scores for Dr. Kraft were all really high. So as a whole, I think we hosted a pretty successful conference that people felt like they learned something and enjoyed. I wanted to ask all of you that were there, just kind of as like what your overall impression was, what you thought we did well, maybe what could have been improved.
I think it went very smoothly, in my opinion, even with the hiccup of it having to switch out the setup and all of that. I think everybody just jumped in and we made it happen and made it a space that was really set up to what she needed to make the learning work the best. So I think I'll keep thinking on what we could have improved.
Remind me what our goal was for attendance. Was it 100 we were hoping for?
I think initially you're right. Yeah, it was 100.
There were a lot of other things going on that day.
Yeah, the thing that came to mind for me is I wish we would have had more parity was maybe state representation, but I don't know if we could have, what we could have done. I think there were several factors that this training was a little different than a lot of the ones Missouri has, or the cost. What did everyone think of Dr. Kraft that was there?
I thought she was great. Yeah. I mean, I thought that it went really well. We had to make some, changes when we got there because the venue wasn't set up correctly. But I feel like everybody just pulled together and no one even knew that there was an issue. Dr. Kraft didn't know that. I mean, other than walking in and finding the room, but she was like this, she felt like everything went great too. I feel like everyone that was there really enjoyed it. And I thought it was nice. I'm glad to hear that the evaluations were very good. I mean, I think 4.92 is pretty good.
Yeah, I saw your comment, Lisa. I can send the Excel file to you.
Oh, that'd be great. Thank you.
Or if anyone else is interested, I can attach them just to the notes for today's meeting. I wrote a nice note about Israel, who helped us set it up, and sent it to the people there. They appreciated that, but they claim that I told them to put up round tables, which I didn't. I was kind of disappointed that they put the blame on me.
Yeah, there were several things that he had to step in and do. That is frustrating.
Well, overall, I think the space was good for what we needed, and the kitchen ended up being really helpful. Has anyone heard back from any of the providers that attended, or did you get any additional comments from people that were there?
That was, I guess, something that I was just thinking that I wish I personally would have done a little better at, because one of my providers did say that they had been there and I didn't even notice her. So I personally feel I could have done, I even claimed one family that wasn't our providers, and because I thought it was the same name as a new provider. So I introduced myself and was trying, and they'd been a provider for like 18 years in another jurisdiction. So anyway, I just think I personally could have done a better job of really making Wyandotte County providers that were there feel that personal connection, and I failed with at least one person.
I have a few pictures from the day. If anyone else has any that they want to share, that's good for us to have on file with some of our storytelling. I think another thing that I got some feedback or some emails after was that really people were really impressed and appreciative with all the door prizes. So I think that was great that we could give everyone something when they left. Sorry if they're kind of blurry. For some reason, when I sent them from my phone to my email, the quality got a lot worse. And Kelly sent me some photos too. And the ones on the right were from providers that sent them to her after the conference using some of the materials that they created at the conference. Diane also sent us a really nice summary that she submitted for her CDC part work on it, and just complimented how engaged everyone in this training was. And she only had very nice things to say about the conference and all of us, and enjoyed working with us. So I think that's good.
I was just going to type that in the chat. I felt like everyone was really engaged, and when we got up to do activities and things, they really enjoyed it.
Yeah, she says some people just aren't comfortable being that goofy or playing as adults. She talked
Yeah.
about doing one in New York prior to here, and our group was a lot better about participating.
I feel like the participation did wane a little bit in the very latest pieces of it, and people were just kind of, some stayed at the tables, not because you could be not directly involved and still be engaged in the activity that's going on, but watching and absorbing and observing and those things. But I think in that last time that we got up and went over there and did an activity, there was a lot of just checked out people. And it not through anybody's fault other than it was a long day and our participants, some of them were just done.
Yeah, I think you're right. And we ended up finishing, what, 15 minutes early or something, because I think everyone was noticing the fatigue on participants' face after being there all day. But that was nice of Dr. Kraft to work with us and recognize that. Okay, I think that's all I have regarding that conference. Us as a group, I wanted to put it on your calendars that for our Kansas City Healthy Lifestyles Collaborative quarterly meeting, that'll be in December. It'll be December 5th. We have an early education professional. She'll be the primary focus of that quarterly meeting. Her name is Dr. Chelsea Cratch. She's a kind of relatively new associate professor at KU Med. I was telling Lisa about her a little bit. She worked at several universities prior, but one of her previous projects was adjusting physical activity guidelines in early childcare settings for the state of Louisiana. And they made those based on some of those Go Knapsack guidelines and best practices. So I thought that might be a particular interest to this group. It's an in-person meeting at the Kauffman Foundation from 9 to 11. Breakfast is provided, but there's also a virtual option if you're not able to attend in person.
Do I get breakfast sent to me if I'm doing virtual?
I don't think we could do that.
Come on, Natalie.
Not up to me. I'll push it past Robin.
I mean, I'm gonna go, Chris. I'll pack you up a doggy bag and mail it.
It'll be so tasty when it gets here, Lori. Can't wait.
I kind of hope it's oatmeal.
And then I just kind of two questions to pose to the group. It's kind of like we had our survey, and then we designed this training based on what people said they wanted. But as a group, we kind of need to refocus and think about what some upcoming projects might be. I don't know if we want to, as a group, maybe think of some potential speakers to add to our meeting agendas coming up. And then like content area that we want to focus on moving forward. If we want to talk about that now, that's fine, or people have ideas, or if we want to just have everyone think independently and send some ideas or be ready for our next meeting, I'm fine with that too. Any thoughts?
I think, Rhonda, didn't we have someone that to be a kind of a guest speaker, like a partner highlight? Didn't we kind of, you mean, I can't remember who it was, but I thought you sent us somebody something.
Ooh, you have to remind me. I have
I'll
to
go back
dust
to
off
my
my
email,
brain.
like, okay.
But I would be happy to organize that.
I think it was your contact, so I'll pull it back out and find what it was. And then backtracking a little bit, is it appropriate? I mean, I think a thank you is often appropriate, but to write anything to the larger group for the funds that were contributed towards this, or or not.
Trying to think. The KCPA plans that were awarded to this, I think it was originally a Kaufman donation. I don't necessarily know if it's necessary.
Since it's funds from there to there to there to us. Yeah,
Yeah.
okay. I just wanted to make sure.
I assume that there's a report that we have to submit since it was maybe not.
I don't,
You don't think
Not a
so?
formal one, like,
They just give us money and that's that. That's good.
I think it might be good for us to do kind of a wrap-up summary to the core work group for the KCPA plan at some point.
yeah, because I would assume that Robin's gonna have to report. Because it was a grant, correct?
Especially if he is seeking future funding from that group. I think they like hearing some success stories.
Yes.
I was gonna say, you could maybe just incorporate a note of appreciation in that, weave it in there somehow.
Mhm.
I
But thanks for-
apologize, Rhonda. It wasn't your contact, Natalie. It was actually yours for the pedal kids.
Oh, yes.
I'm not crazy.
You're right. So many contacts. I can't remember what their organization was called before, but they just went through a rebranding and they have some new staff. So they'd reached out to presenting on some of their new program and expanding efforts in the Kansas City area. So I could reach back out to Mickey and see if they're interested in coming to a future meeting. Got me thinking. Kelly, I got thinking about other research that came out this past week. There was a new physical activity report, like a national physical activity report for youth, but I'm not sure if it included early childhood age kids, but I can send that link to all of you too. Especially if any of you are involved or any grant writing or something, it's like good data to include.
Oh, go ahead.
Yeah, no, you can go ahead.
Oh, okay. I was gonna ask if you can refresh my memory. What was, had we talked about what our next goal was after Dr. Kraft?
We
Okay.
really hadn't.
Okay.
We kind of do need to do some group brainstorming.
Sounds good.
Natalie, was that report you're talking about, the US report card on physical activity for children and youth?
Yes.
Okay.
On the agenda, I also have just a reminder that they're looking for the social media partner for, or the campaign, the Move Together KC campaign is looking for partner spotlights. So if any of your organizations would like to be featured, it doesn't include like a lot. Usually it's just like a sentence or two that they'll include in the post, tag your organization, include a picture. And they get those calendars usually prepared a month out. So sometimes if people have an event that they want to promote, it's good to send it to us the month before so we can get it on the calendar. I guess if everyone wants to give it more of a think, about who might be some good presenters for the future, you can just email them my way and I can get in contact with them. Our meetings, we changed the meeting time. They're now on the third Monday of the month at 9 a.m. Our next meeting will be November 18th.
Natalie, did we do or did we think about maybe doing like a big, not a big, but like kind of like a news flash that our meeting time has changed to like all former attendees, even if they came like one time, like any of the emails to get some momentum?
I can send that out. I noticed that of all of our sectors, the early child one grew the most this past year. When I started our mailing list, I think it was like 90 people, and now we have like 170 some of it. I'm not
Nice.
sure if it's from these events or where people are signing up from, but or maybe the resource survey when that went up. But yeah, we have doubled in a year.
That's good.
Does anyone on this meeting have any organizational events or trainings or anything that you want to share with the group?
I can share, I don't have it in front of me because it's not directly from my office, but I think, oh, Lori, I think you know about this, but so there is a, I don't want to call it department. It's not a department, but there is an office not very far from me that is the LEND program. Yeah, Lori's familiar with that, and they offer childcare classes for free. Looks like a lot of people are shaking your head, so you already know those. My office does offer 2 webinars a month for free and 2 echoes. I don't know if you are all familiar with echoes and what echoes are. I see some of you. So a quick synopsis I will share because I've just recently learned what they are as well. But this format came out of the University of New Mexico, and it was efforts of addressing rural areas where there wasn't a lot of opportunities for professionals in the medical field to be able to connect, to be able to share cases with each other, get their experience, get their advice for free. And so an echo that we would have in particular would be like 40 minutes of a presentation, and then either the presenter or someone that is attending would come up with a case, and then the presenter would give their free advice. No, they don't. Not at this time. Good question. We have discussed that internally. So our focus at the Kansas Center for Autism Research and Training is around autism as well as IDD, but our target audience is caregivers as well as professionals that help support foster children. I really think that a lot of our training are what do I want to say, are really welcome anyone to come by any means, so that you can learn whether it is, it could be applicable to anyone. So even thinking of as an early childhood professional, if you have a concern about a child, we do try to address the little people as well, to make sure that we're just not always focusing on elementary and older and teens, because we all know the importance on this call of early childhood and early intervention. But I'm more than happy to put our website where you can register. We try to do one in the afternoon, and then we'll do a 6 p.m. one as well. But various topics like picky eaters, we've had that one. We've had just fostering teens has been another one that has been asked. But we try to recruit professionals through either KU Med or other outside entities that have expertise. But it is definitely focused on behavioral health, which I think is really applicable to all professions. Thank you.
I'm not sure if I shared this in a previous meeting, but I've referred to our child care health consultant network before. Well, unfortunately, we lost funding. It was ARPA funding, and other entities were not able to pick it up at that time. But one of the CCHC did a lot of things, but one of the I think pieces that's going to be really missing is supporting those potential new providers. So we're looking at other means to do that. We are also going to meet, we're doing a big push in Kansas to increase usage of the Go Knapsack tool. We're going to be meeting with all the licensing specialists in January to talk about that, because that would encourage, they're all out there talking to temp providers, potential new provider, well, really not those, to make sure that they're aware that that's available. And we do have KDHE hours for training for that. So we're also working with our infant toddler network here in Kansas for usage for Go Knapsack. So just doing a big push.
Thanks for sharing those links.
So Chris, with that, Go Knapsack and the infant toddler services, will they be able to provide technical support then, or is that the piece that okay, perfect, thank you.
Yeah, just, making, sharing the information with educators that it's there, that there's resources, and yes, that they need technical assistance for working through, if they want to do the goal setting. So just having more folks aware of it. And again, licensing specialists, you were kind of the first. You see a lot more educators than they'll reach out to people. So we want you all to be aware as you're out there and you're looking at different compliance issues, and say, hey, maybe looking at these resources might help you in whichever area it is. So.
Lisa and Chris, I think I messaged you about the researcher that wanted to study Go Knapsack data for poster states. Did she ever reach out to either one of you to ask questions?
No,
Oh.
I don't.
Okay,
I
was
didn't never
just
hear
curious.
anything.
As I say, I'm like Lisa, I vaguely remember you saying that, and I think I responded to her, but no, I haven't talked to anybody or filled anything out in depth about Go Knapsack from anybody outside. So guess she didn't want us, Lisa. She had other people.
Well, I think she's teaching too, so maybe she's just
That could be, or
put on
maybe
the
she
back
just,
burner.
yeah, maybe she just got
forgot like
busy.
we did.
Yeah, got busy, and she'll revisit. And I'll revisit my email just to make sure I haven't missed something, because that could always happen too. I've been on the road a ton. But I'm excited. So you said the person that's speaking, this Chelsea Cratched,
Yeah.
it does have experience with Go Knapsack?
Yes.
Is that what you said? Yeah.
Yeah.
So that'll
Her
be
expertise in research is like pregnancy to age 5.
Oh, that's awesome. That I'm excited. And they'll send the link to register for December 5th. Will that be in the next newsletter or whatever?
Yeah, I can make sure to include it.
Okay, perfect.
Yeah, I don't think we've had a specifically early care age focus before. When we were thinking about ideas for presenters, the business and industry sector, they just had a representative from the National Physical Activity Plan come to their meeting and talk about some things they're working on nationally. So maybe that's something I can look into, is reaching out to that group for the problem with that for our group is that's where we diverge from the national plan, is we broke up the school group into both schools and early age. So I might have to do some research